we are estimating the overall burden of disease across the globe. We all know that the prevention is better than cure, right? So we have to estimate the overall burden of disease to combat the burden. So in this study, we have estimated the Parkinson disease in the last 3 decades from 1990 to 2019. It comprised more than 10,000 collaborators across the world. Here you can see that the burden of Parkinson disease in the last 3 decades has been shown to be increased. In like these are incidence counts, these are deaths, and this three graph showing absolute count. This one, the lower one, is showing its standardized rate. So if you look at this absolute count, it's showing the continuous trend from in the last 3 decades. When we standardize by age, deaths and disability has been shown it's a kind of a plateau, right? But in terms of incidence from 2005 to 2019, it is showing the sharply increase. So this could be the aging population and other environmental risk factors and the diet lifestyle modifications. In US, the incidence was quite high compared to other countries. Immigration could be one of the reasons, but US is also doing well in terms of controlling the deaths and disability, but in terms of incidence, it's quite high. And another factor is aging or environmental risk factor, because since last 1 decade, with the technology advancement, lifestyle it's like totally changed. Our study's target audience is public health policymaker and public stakeholders, because they are the major people who can help or who can make a strategies to combat the disease burden. We are sending one message to these organizations so they can understand like in which countries they have to invest more in terms of research and other healthcare related funding. The burden is increasing, so we have to work strategically.